So without further ado, I'm going to introduce one of our panelists, the first one, Dr. Niteesh Bharara. He is the director of regenerative medicine at the Virginia Spine Institute. He has redefined outpatient treatment options for athletes and active individuals suffering with spine or orthopedic conditions. Dr. Bharara is leading the Mid-Atlantic region in performing effective natural therapies such as stem cell therapy, PRP, prolotherapy, and lipogem injections. He has been named the 2020 Face of Regenerative Medicine by Washingtonian Magazine. Dr. Bharara?
So I'm Niteesh Bharara. I'm a physical medicine rehab doctor that takes care of a lot of acute and chronic pain. I specialize in regenerative medicine, and today I'm just going to really quickly discuss regenerative medicine for orthopedic conditions. So this is a very broad topic. So I'm just going to touch on the basics on it, and then we're going to have some time for some questions. So let's get into it. So as mentioned before, musculoskeletal pain, the most common cause of long-term pain and physical disability, really affects millions of people worldwide. And at any one time, 30% of adults will have some sort of joint pain. And breast cancer patients are actually 25 to 50% more likely to experience some type of joint pain for a variety of reasons. It could be they're also from their cancer medications. So we've all had orthopedic issues and injuries, and as we've all heard, the first thing you always do is you rice it, you rest it, you ice it, you compress it, and you elevate it. And then if that doesn't work, you can try some other things like anti-inflammatories or steroid injections or physical therapy. But all of these treatments really just get down to treating the symptoms. Nothing is really treating the underlying problem. So that's where regenerative medicine comes in. So regenerative medicine actually fixes and treats the underlying injury. And so how do we define regenerative medicine? Well, it's simple. This is a field in medicine in which we use our own body to heal itself, and we want to restore function and reduce pain. And to really understand regenerative medicine, you have to understand how grass grows. So so to grow grass, we need seeds. We need fertilizer. And that's the same thing we need in our body to grow tissue. So when we have a lawn that maybe has some sparse grass, sometimes we can just kind of put a fertilizer on the area and get that grass to grow. The same thing on the orthopedic injury area. So if we have an injury that's maybe a mild injury, and we just need to kind of get that tissue to start growing, sometimes we can just kind of put that fertilizer on the area of the injury or growth factors. And that's equivalent to something called PRP or platelet-rich plasma. But sometimes that lawn is really is not doing well at all. And sometimes we need to place some seeds there to get the grass to grow. And when we want to do that with an orthopedic issue, we would want to put cells or stem cells at the area of the injury to help the tissue grow. So growth factors are equivalent to something called PRP, and stem cells are equivalent to something like the seeds to get the grass to grow. So just as I mentioned, the fertilizer is also equivalent to PRP, and PRP is a product that we get from your own blood. So we get the growth factors out of your blood and we place it back into the area of the injury to get it to supercharge that healing process. And sometimes if the injury is more severe, we would use stem cells or the seeds to get that tissue to grow. And we can get that stem cell from the patient's own bone marrow or their fat. So like I mentioned, when somebody needs a PRP injection, this is where we take their blood, we separate it, we take the platelets out of it. And the platelets are where all the growth factors sit. And then we mix it with some plasma, and that's called platelet-rich plasma. And so we can place that specifically back to the area of the injury to start fertilize the area and get that area of injury to start healing. Sometimes we need stem cells. So that's where and stem cells are cells that can turn into any type of cell. So this cell can turn into a tissue cell or a nerve cell or a muscle cell. It can turn into any different type of cell. So that's why they're extremely interesting. And it's really important to understand we're not using embryonic stem cells in this situation. we're actually using something called adult stem cells. And it's really important to understand the difference. Embryonic stem cells are very controversial, and they have the potential of turning into maybe tumors or other issues. So we don't want to use those at all. We want to use adult stem cells, which can only turn into a few different types of cells, including muscular cells or bone cells or nerve cells. So they are very safe, and through many studies, we have shown that they have no chance of developing cancer or really any other issues. So it's an extremely safe treatment option. And so we can get these stem cells from different areas of the body. We can get them from the bone marrow. We can get them from the fat. And so, and there's some other places as well, but they're very highly concentrated in bone marrow or fat. And when a patient comes in for a stem cell procedure, we take some bone marrow from their hip and we separate the stem cells out of it. And that's what we place directly back into the area of injury. Or we can do a liposuction, get the fat out of it. We process that fat, get the growth factors as well as the stem cells out of it, and place that directly back into the area of the injury to get that orthopedic injury to start healing. So we treat a variety of conditions with both PRP and stem cells. We treat arthritis in many different joints like the hip, the shoulder, the knee. We treat ligament issues like the ACL. We see tendon issues like tennis elbow. We do it a lot in the spine when you have a disc problem or a joint problem in the back and you can't move very well. It's very commonly treated there. Or if you have a muscular tear, we can also use regenerative medicine, and it works very well for many of these diagnoses. So that's just kind of touches on the basics of regenerative medicine. I'm going to be happy to answer any questions that come up. And we're going to have some questions a little later on in the presentation.
So this first question is going to go to Dr. Bharara. One viewer wanted to know whether age has any impact on the benefits or the outcome of doing PRP. And then I'm just going to tag on another question. Who performs the regenerative medicine procedures? Is it orthopedics? Can anybody be trained to do it? And I'm just going to throw in there, is it still not covered by insurance?
Yeah. So these are all good questions. So we'll start off with the first one in terms of age being a factor in regenerative medicine, and they mentioned PRP. So age is a factor in healing in general. However, with PRP, it's not as big of an issue. We're more concerned about the severity of the injury. That's really what we have to decide and what we're trying to treat. There are some injuries that seem to lend better to regenerative medicine and have more success than other injuries. When we're talking about stem cells, as you get older, we are seeing less and less volume of stem cells in bone marrow as well as in fat. Less in bone marrow than in fat. So as you age, we are seeing less stem cells. So we would have to harvest more to get a higher concentration of stem cells. So we do take into account age when we are treating an issue. However, when we're doing regenerative medicine, as you get older, the healing potential drops slightly. So we are seeing that younger people seem to do better for many different regenerative medicine procedures. But that's not always true. There's been some studies that have looked at treatment of the use of PRP in knee pain, and it's not really dependent on age. It's more dependent on how severe the arthritis is in the knee joint, and then the actual approach to treating the knee with the PRP. So I think that's more of an issue. Now, the next question was about cost and about insurance coverage. So in the past, there has been this thought that many of the regenerative medicine procedures aren't evidence-based, and that's really not true anymore. We have a significant amount of evidence that have shown regenerative medicine to actually be far superior to steroid procedures that are covered under insurance, as well as in the knee, gel injections. And I was going to put a couple of slides in about some of the evidence that we have. We also have seen it to be much more effective in the spine when we're treating degenerative disc disease. We have a couple of studies that have shown to be extremely effective in the disc that we have recently published and we've presented on. So the idea that it's not evidence-based is not true. And insurance companies are actually starting to pick up the use of PRP for many different conditions. So, for example, TRICARE now covers regenerative medicine, and specifically PRP, for osteoarthritis of the knee. They cover it for tennis elbow and lateral epicondylitis. So as time goes by and as insurance companies now start reviewing the evidence that we do have for regenerative medicine, I do believe it is going to become much, much more mainstream and going to be covered under many different insurance plans.
Awesome. Wonderful. Thank you so much. A viewer wanted to know if Medicare is covering, not just commercial insurances.
There is a thought that usually Medicare and TRICARE cover similar procedures. But as of right now, Medicare is not covering what TRICARE is covering. So I would imagine over the next year or two, we're going to see that Medicare starts picking some of these procedures and actually covering them. They usually don't look at these procedures. They only do it once a year. So we're probably not going to see that change over this year anyway. So that being said, the recovery time on a regenerative medicine procedure depends on what you're treating. So if we're treating a joint, such as the knee, many times it's you take it easy for the first 2 weeks after the procedure, and then you kind of get back to doing everything you want to do. Most people go back to work the next day. It's a fairly easy recovery time. For treating a disc in the spine, it's a little more complicated of a procedure, in which we're going to have to go into actually place the needle into the disc and then place the regenerative medicine substance that we decide to use, such as stem cell or PRP or whatever other substance we decide to use. And that does cause an increase in pain for a few days after the procedure. And then the healing time and then there's some healing time and increased pain that lasts maybe anywhere between 7 to 10 days. And most people will return back to work in about 7 days, and we'll see the benefit anywhere between the 4 to 8 week mark. And then we'll start the healing process from there. So the recovery time depends on the patient, but it's significantly less than any surgical time, and usually anywhere between just a day or two to a couple of weeks.
Thank you, Dr. Bharara.